publish this book within a few couple of years. So we decided to do the first of the Bangla version of that, and that was published actually in 2022. And then we thought that it's important that such a story should be told not only to Bengali-speaking people, but also people who don't understand Bangla, and to the larger world. And that's why we have this particular book that I want to present to you today. So there's this short story behind this book, and I'm going to sort of quickly go through some of the salient things that are included in that book.
Right.
Okay, so what I mean, over the last several years, you have been seeing some of these headlines in the global sort of media a lot. One of them is that Bangladesh has sort of graduated into a lower middle income country, and there are writings in the New York Times by columnists like Nicholas Kristof, who advised President Biden when he was elected in 2020 to really look to Bangladesh if he wants to solve America's poverty problem. So that came out in the first page of the New York Times. So that really sort of gave a lot of attention to the Bangladesh story. And nowadays, we know Paris as the fashion capital of the world. But nowadays, many people who are interested in development, they look to Bangladesh. They want to come to Bangladesh to see what has gone there and to understand more about how Bangladesh has been able to really do it. And also that Bangladesh story is very much well connected to the work of the non-governmental sector as well, in addition to the government, of course. And Bangladesh is the home to many of the most successful NGOs in the world. The BRAC, for example, the Grameen, Ganashastra Kendra, and many thousands of NGOs in Bangladesh. So it's quite unique from that perspective. But there is a part there. The part is the paradox. Bangladesh has done so well despite some of the major challenges that are there. So what are those challenges, and how Bangladesh has really sort of been able to face those challenges and move forward. But we have done well so far, but there is no room for complacency. And I will be talking about why I think that there is no room for complacency. We have to move forward and so on and so forth. This is something which is already known to you. I mean, most of you are Bangladeshis. But one of the things which I want to sort of highlight here is the density of population. And Bangladesh is the most densely populated country in the world. And as you can see here, that the density per square mile for Bangladesh is about 3,500. Whereas if you compare with the state of Florida, it is about 1/10 of that. So this itself sort of indicates the kind of challenges that a country like Bangladesh is grappling with. Now, this one shows the different mortality rates for Bangladesh over the many years. And it shows that in almost all the measures of mortality, Bangladesh has been doing very well over the years. And the most significant one is the black one, which is at the top. And that's the maternal mortality ratio. So when until about the 1990s, Bangladesh had one of the highest rate of maternal mortality. it was over 600. It was probably the second or third in the world after Afghanistan. But over 2 decades, for example, by 2010, it came down to less than 200. So that was kind of quite a miracle, such a sort of big drop in such a short period of time. One of the important aspect of the Bangladesh story is that not only the improvement that has happened over time, but the speed, the amount of time that it has taken to achieve that. This seems to be only comparable to what happened in Japan during the Meiji restoration of the 19th century. So that's another aspect of the Bangladesh story, that we have been able to do such good things that I am talking about in such a short period. The red line is the life expectancy. As you can see that the life expectancy is increased over time consistently. I will come back to the life expectancy later. Total fertility rate is the number of children that a woman leaves behind during at the end of her reproductive period. And as you can see that when Bangladesh became independent, the total fertility rate, the TFR, was over 6, about 6.6, and over time it has gone down. Now it is said to be about 2.3. So it's a huge sort of decline over the years. Particularly, this is significant because Bangladesh is a Muslim country, conservative Muslim country, and the use of family planning has also played a very important role, of course. But there's the supply side, but also on the demand side, I will be talking about that it has also done very well. This one compares the Bangladesh trend with that of Pakistan. In 1971, obviously, both Bangladesh and Pakistan, we had very similar TFR. But over the years, Pakistan's TFR has remained quite high, as you can see here. 3.6 for Pakistan and 2.3 for Bangladesh. The other line here is that of West Bengal. You may ask, why West Bengal here? Why are you comparing with West Bengal? The reason is that West Bengal is very close to us. There are many similarities with us with respect to the culture, the language, and so on. And we wanted to see whether the changes that are happening in Bangladesh is kind of a secular change, or it is not. So we wanted to also compare with West Bengal. And as you can see here, that West Bengal started much better, even in 1975. But it is still doing better than us. But what is important is the gap. So gap between West Bengal and Bangladesh in 1975 was about 3 children per woman, and now it has been reduced to much less. Although West Bengal has been doing very well, and that it has its own story, of course. But Bangladesh has been able to really close the gap with West Bengal quite significantly, as you can see here. I've come back to life expectancy, and here we have the life expectancy experience that is compared with 3 countries: India, Pakistan, and Sri Lanka. And as you can see that the time Bangladesh became independent, the life expectancy was quite low at that time for Bangladesh. And but over time, it has increased to what it is now, about 73, 74. But what has happened as well is that Bangladesh has also surpassed two of our important neighbors in terms of the life expectancy, and India and Pakistan. So we have done quite well compared to some of our neighbors. But also when you why we included Sri Lanka here? Sri Lanka is we have included Sri Lanka here because Sri Lanka is also another neighbor of us. But we haven't been able to really beat them as yet. So what we have done, fortunately, is that if you look at the gap, so in 1960, the gap between Sri Lanka and Bangladesh was about 15 years. And now, as you can see here, the gap has been reduced to 5 years. So although we haven't been able to beat Sri Lanka yet, and there's our next target, we have done well with in sort of, and it shows that we are on the way. Hopefully, if we can sort of maintain our progress as we have done before. The other thing about life expectancy is the gender difference, and normally in any population, women live longer than men. But until the 1980s, Bangladesh was one of the 3 countries in the world where women lived a shorter life than men. So that was a total anomaly, and that was a big shame for us that we are a nation. We haven't been able to give enough status to our women. But fortunately, as you can see here, from 1990, it started to change. And now, women live about 3 years more than men. So this is a huge achievement that we have been able to correct that mistake, that thing that has happened. Also, with respect to child nutrition, as you can see that we have been able to really make good progress with respect to both the stunting as well as the underweight thing. And it has been sort of showing reduced rate over the years. But what is important here as well to remember is that 31% of our children are stunted. So this is a huge shame on us. 31, nearly a third of our children are stunted. So we have to really work on that. So there are many things that need more attention, and one of them is the nutrition. Now we have all those good story, but is this a case of positive deviance, in the sense that we have been able to do it despite some of the problems that the country is facing, some of the challenges? Bangladesh is a country where the investment on health from the government is very low. Only 0.7% of our GDP is spent on health, which is probably the second lowest in the world after South Sudan. I have been talking about what Sri Lanka has. I was comparing with Sri Lanka. And if we compare how much they spend, it is about 4 times of us. So investment in health is very important, of course. And unfortunately, we haven't been able to do much here. Also, we have a large private sector now. There are many hospitals. Some of them are very high-end hospitals. And there are many clinics, and also there are both qualified and unqualified private physicians there. But this is almost totally unregulated. The 1992 there was a sort of a law passed in 1982 that gave sort of credence to the private sector, but there hasn't been much sort of changing the status of that law or regulation that was there, and it was not implemented in the way that it should have been. So we have a private sector which is very much unregulated, and we have seen that in the COVID period that there are a lot of problems with the private sector as well. Of course, poverty is there. Although we have done very well in reducing the poverty in the 1990s, for example, 80s, 60% of the Bangladeshis were poor by any standard, but it has now been reduced to 24% or even less than that. But this also shows that a quarter of our population are poor by any sort of measurement, and which is about 40 million. 4 crores of people are still poor in the country, and there are issues of governance. We always hear about corruption, and also in the health sector, the absenteeism, for example, and so on. So despite all these problems that we have, all these challenges, the country is moving forward. And why is that? How it has happened? That's a big question that is being asked globally, internationally. And what I'm going to do now is to provide some explanation for that. So I have divided my explanation into 2 parts. The first one is, how do I explain it from a health perspective? What are the health-related interventions that have been done that may have contributed to that? And also to the non-health sector, because we know that 50% of changes in health can be explained by health interventions. The rest 50% we have to look to other sectors, but the contribution of other sectors in making those changes. So the first one is what are the breakthroughs that have been done in the health sector. The government has expanded the health facilities enormously over the years since 1971. Dr. Iftikhar was talking about the community clinics which have been set up since 1996. There are about 15,000 of them now, although there are many opportunities to improve the services, of course, but the sheer availability of that, even having a building is important, although there are many questions about the quality of the services provided. Also, I talked about the private sector, and also a major important role has been played by the drug policy of 1982, which made the essential drugs easily and cheaply available. So that was a kind of a revolutionary thing which was done for the first time in a developing country. So Bangladesh really took the lead in having a policy on drugs, which sort of which was not liked by many of the multinationals, and we know of all the old stories about that. Also, that Bangladesh is a country which is known as the crisis country with respect to health workforce, and there are problems of shortage of healthcare workers, doctors, nurses, midwives, technicians, and so on. Also, there are maldistribution of that most of the workforce that we have are working in the city of Dhaka and Chittagong and the major cities, so because of these, the health sort of workforce situation is said to be in a crisis situation. But given that we cannot solve this problem overnight, we cannot train thousands of doctors. So there has been a lot of talk about creating a para-profession like the community health workers would be given short training and also would be supervised to provide the sort of necessary services that is available to that has to be available to the people, because most of the problems that the people have do not require a physician. It can be tackled by a person like community health workers. So Bangladesh decided to train thousands of community health workers, and that was done both by the government and the NGOs. So BRAC, for example, they trained alone about 100,000 community health workers. And the story of community health workers goes back to the 1960s in China. You may have heard about the barefoot doctors of China. And the Chinese miracle in healthcare was actually started by these barefoot doctors. In 1978, there was a huge sort of a first conference on primary healthcare in Alma-Ata, Tajikistan now. And in that sort of set the tone for the healthcare that has to happen in the world since then. And in that particular declaration of what is now known as Alma-Ata Declaration, it promoted the use of community health workers in the nations where there are not enough physicians and nurses and midwives. So, since 1978, there has been a lot of experiments all over the world, including in the United States, to training community health workers. Most of those failed, unfortunately, but some of these did very well, and a few of them are actually done in Bangladesh. So the community health workers of Bangladesh, which are trained by BRAC, for example, Algona Shastra Kendra, they have been really instrumental in making the health revolution in the country. Research played a very important role in Bangladesh, and the name of an institution like the ICDDRB, which is the International Center for Diarrheal Disease Research, which is one of the top research institutions globally, and that is located in Bangladesh. It used to be called the Cholera Research Laboratory. It was set up in the early 60s, and it has really gone beyond the diarrheal disease as well, and have been contributing to solving the health problems of the people. ICDDRB is the one which invented the ORS back in the 60s. Some of the research institutions in Bangladesh have really played a very important role. BRAC's Research and Evaluation Division also played a very important role. And one of the reasons why some of the BRAC interventions, the field interventions, have been very successful was the use of research in the implementation. And what we now call, for example, the implementation science. The World Bank has been promoting this concept for the last 10 years. But this very concept of implementation science, implementation research, was used by BRAC in the 80s. So research actually played a very important role. The third category I would say is the demographic and health surveys, which has been carried out with support from USAID all over the world in about 70 countries since the 90s. And Bangladesh was fortunate to have these DHS many times over the years. This also played a very important role in really sort of making changes in the policies of the government. So research played a very important role in this story. And finally, there are many what I call the public health actions at scale. The things which the NGOs and the government have actually undertaken to solve particular public health problems. So one is, for example, malaria. Malaria was very rampant in the country. Then the government started the malaria eradication program, which was one of the most successful programs. Although malaria hasn't been totally eradicated from the country, it is, but for about 99% of the country, the country is free of malaria. We still have some malaria in the borders with Myanmar and India, but apart from that, the country is free of malaria. Then we have family planning, and as I was saying, that we have reduced the total fertility rate, and family planning played a very important role. And now, about 65% of the eligible couples use some form of family planning, which is quite significant for a Muslim-dominated country. Also, the water, sanitation, and hygiene. We have actually made very good strides. Until the 1990s, Bangladesh, every person in Bangladesh had access to potable water. But unfortunately, in 1992, we first sort of heard and discovered that the water that we have been drinking from the hand pumps, we call it tube wells, it has until the 1990s. So the arsenic problem is still there. Unfortunately, it is a forgotten story now. Nobody talks about that, but the problem still remains. The other problem is the tuberculosis, and Bangladesh is said to be one of the high burden countries. But Bangladesh has been able to really innovate ways of solving the TB problem. The treatment of choice is what is now called the DOTS, directly observed therapy, short courses. And we have been able to really devise ways, innovative ways of how to solve two problems that any TB program encounters. The first one is identifying the case, because if you have TB, people don't want to say this because of the social stigma and other things. The second is, once it is identified, the patient has to undergo a long treatment. Now it is about 6 months. So if you start the treatment, within a month you feel better, and people stop it. And this leads to sort of problems of drug resistance, the multiple drug resistance and so on. With these two problems in front of us, the BRAC sort of started a program of training the community health workers on identifying the TB patients and also providing the DOTS. And because of these and the programs that are also run by the other NGOs, the treatment completion rate in Bangladesh is one of the highest in the world now. And the other important aspect of that particular program on TB is that this is probably one of the few countries in the world where a national program has been handed over to the NGOs to implement, and it shows the trust that the government has on the NGOs as well. The government has created the space for NGOs, and that's why we are seeing so many NGOs in the country, and some of them are really big ones. So it is a good example of how the government and the NGOs have been working together for the development of the country. This one shows the use rate of ORT, oral rehydration therapy, and you probably know that the treatment of choice for any diarrheal diseases is the oral rehydration therapy, which is in short ORT. And in the 1980s, many of you who have been sort of in Bangladesh around that time in the 80s have seen how the promotion for Laban Gur solution was being done in the country, and this was done by track workers. They visited every household in Bangladesh to teach one mother on how to prepare ORS at home with salt, sugar, and water. Because of this work over the years, over a decade, Bangladesh now has the highest use rate of ORT in the world. 80% of diarrheal diseases are now treated with some form of ORT. And if we compare it with other countries, Pakistan has about 30%. And also if we look at the mortality impact, I mean, diarrhea was one of the major cause of mortality until the 1980s and 1990s, but it has gone down sort of drastically over the years. And many of you are familiar with this logo, which is the vaccination logo, the EPI, the Extended Program on Immunization. And until 1980, there were the coverage rate for immunization in Bangladesh was only 2%. But then at that time, the government decided to really push that. And they invited the NGOs and the donor communities and the private sector. So together, they worked to implement the EPI in Bangladesh. And within 5 years, by 1990, the immunization coverage rate shoot up from 2% to 70%. So that's another example of how a sort of important sort of intervention can be scaled up in such short time. And the other important thing about this is that initially when it was implemented, it was a vertical program. But there are a lot of questions about vertical programs that, I mean, once the support and the interest on the vertical program is withdrawn, it will die down. But fortunately, I can tell you that it hasn't happened in Bangladesh. Although this vertical nature of the program is no more there, it is now part of the health system. And we have been able to really maintain very high immunization coverage. This is an interesting graph. I mean, those economists, Choi is here. So there are many economists here, and they talk about inequality. And the way they want to measure it is through the Gini coefficient. And we know that the Gini coefficient varies from 0 to 1. And as you can see here, the graphs, the bars. The bars shows the Gini coefficient for income over the years. And as you can see that the Gini coefficient is about 0.45. Although over the last several years, it has gone up even now. So this shows that there are a lot of inequalities in income in Bangladesh, which is well known, of course. But the red sort of line shows a new sort of index that we introduced at the request of Professor Amartya Sen. He said that why not also try to see, sort of construct a a new index with the several public health interventions that have been carried out in the country on ORT, immunization, family planning, and WASH, and see the concentration of that and how it is changing over time. And there you see that the index shows that the concentration is very low compared to the Gini coefficient for income, which shows that although the income inequality is very high, but the inequality with respect to accessing these public health programs is very high. And so it shows that the program that were the major public health program that were implemented did actually reach a large population, whether they are poor or women or any vulnerable groups. So that also explains why we've been able to probably see what we are seeing. Now about the non-health sort of interventions, what some people call the social determinants of health. So what is going on there? There are things which an action on those can have an indirect impact on health. And the pictures here, as you can see, that the left one is the ready-made garments, and we know that it is one of the major sort of lifeline of our economy. About 15% of our GDP probably comes from this, and also it employs about 5 million workers, and majority of them are women, and most of them have actually come from rural areas. So it has played a very important role, both in the way they look to the future. The aspiration for life is much different for these workers, and also that it has a big impact on the fertility, because if you are working there, if you cannot really afford to have a child because your income will be affected by that. So it was a kind of a demand side action that has happened. The one in the middle is the education, the children's education, and Bangladesh has done well, particularly with respect to getting children to schools. So the enrollment rate is over 90%. We have been able to maintain that, although there are problems of what happens afterwards, and also what are they actually learning. So those questions are there, but the enrollment rate is really high. and the other one is that the emphasis that was placed on girls' education really paid off. There were many interventions from the government and the NGOs on promoting girls' education through food for education, cash for education, the secondary scholarships for girls, and so on and so forth. So those also played very important role, I suppose. And also the construction of infrastructures. We are very proud of what we see here, the Podda Bridge, for example. But the country has invested a lot in building roads and highways, the waterways, and so on. So the question is how a road can be of help to improve the health situation. And the good example is the maternal mortality. As I was saying, that Bangladesh has done very well in reducing maternal mortality over the years, from 600 to less than 200. But if you look at why Bangladesh was able to do such well, when the basic requirement for reducing maternal mortality is that you have to have access to the emergency obstetric care, what is called the EMOC. And we have tried to build some, but we don't have that in every upazila. Only a few upazilas have that. So what happened is that although we don't have enough emergency obstetric care facilities, but if there is any complication and emergency cases with respect to child delivery, the family can take the patient to the facility where those services are available, using the motorized vehicles or boats and so on. So the roads actually played a very important role in at that level of care. We know about this that Bangladesh has done with respect to per capita income compared to India and Pakistan. Sri Lanka is still ahead of us. The other thing which has happened in Bangladesh, and we are very happy about that, we always talk about that, is that the women's empowerment. One of the popular index that is used is called the gender gap index. And the parameters which are used to construct that gap are given in the figure here, which is the economic participation and opportunity, education attainment, health and survival, and political empowerment. So based on those four parameters, this gender gap index is created. And as you can see here, that Bangladesh has surpassed all countries in South Asia, even Sri Lanka. So Bangladesh has, I mean, there are kind of good proofs that the women's empowerment and the gender equality has improved significantly, and we are almost catching up UK. Also, we have seen in historically the Bangladeshi poets and writers always talk about equality, whether it is poor or rich, or between poor or rich, or between men and women. And this is from Qazi Nazrul Islam's Nari, which anybody can remember the poem? Eh? Yes. বিশ্বে যা কিছু মহান, যা কিছু কল্যাণকর, অর্ধেক তার করিয়াছে নারী, অর্ধেক তার নর. So we really sort of grew up with these kind of beliefs in us in these. And this is just a translation of a poem by our national poet Qazi Nazrul Islam. Which the purpose of showing it here is that it's not only that the government or the NGOs which have been sort of working towards the improvement of the country, but everybody they want change, they want to improve. Also, in terms of the other sectors where we have seen improvements, this is agriculture. The rice production. So over the years, the rice production has improved very significantly. When the population has actually doubled over the years or so, but the crop production has sort of increased by 4 times, which means that the per capita availability of food has gone up significantly. So agriculture played a very important role in the country's development, and particularly in the health area. Also, Iftikhar was talking about the 1970 cyclone, and Bangladesh is the country which is prone to all kinds of natural disasters, unfortunately. And as you were saying that the 1970 cyclone killed about 500,000 people. But compared to that, if you look at the recent cyclones, which has the same kind of force, but it killed only a few hundred people. Why is that? Because the country invested in saving its people. There are thousands of cyclone shelters were built. Thousands of volunteers were trained by the Red Cross and so on. So because of these, we have been able to really save our people from disasters. Also, I talked about the expansion of the girls' education. And finally, I believe that, that the liberation war itself played a very important role in this. The war was not only a war for a piece of land or a flag. It was a cultural war actually, because we wanted to sort of get rid of those beliefs that was not consistent with our culture. And just to give you one example, I mean, until the end of 1960s, family planning was very unpopular in the country, and one of the reasons is that those are opposed by the religious sort of extremists, fanatics, and so on, and because of this, many of the family planning workers were attacked, and there were, so those kind of things happened before the liberation. What happened during the liberation was that the people, those kind of people who really were sort of opposing family planning and other sort of progressive ideas, they sided with the Pakistan army. And with the end of Pakistani occupation, these people also were sidetracked. They sort of started to hide themselves, and that created gave a kind of a open space for the more progressive people to work on development, and that's how many of the NGOs came forward. And you may have heard about a Brazilian philosopher named Paulo Freire. Paulo Freire is one of the top philosophers in the world, and his famous book, the Pedagogy of the Oppressed, which talked about how do you change a society. So what a major way to do that is really to sort of make people conscious about their rights, about their status in the society, and not just making people conscious, but also to make sure that the person you were talking about also acts on that. So that was the philosophy which was adopted by the NGOs, including BRAC and Proshika and others, and they sort of created a kind of a movement in the rural areas, which is now giving sort of the fruits that we are seeing. So the what I'm going to sort of push is that the liberation war actually played a very important role in what we have seen afterwards. Finally, the role of the NGOs. I sort of brought it up a number of times, of course, the NGOs. And the NGOs have been sort of responsible for undertaking many kinds of programs, including I spoke about ORT, the immunization, the drug policy that was done, the microfinance, the microcredit that was sort of implemented in a large way by Naveen, BRAC, and others. So those are all kind of NGO contributions, and many of them were implemented across the country in a large scale. So the question sometimes that was asked is that the NGOs may have sort of implemented that because they have money from the donors and so on. But so what? What impact do you have in changing the different indicators of the country? And this one is one of the rare examples of research, which sort of looked at the impact of BRAC's microcredit program on the survival of children. And it shows very clearly that the child survival experience of the children of BRAC members has improved significantly and is about the same as the well-to-do people in the village. So it shows on the one hand that you can improve the child survival through this kind of activities, but also it shows that the inequality that is there can be removed by actions such as the microcredit program. So this one sort of shows the impact of NGOs. And of course, since I spent almost all my life in BRAC, I wanted to sort of give you some idea about BRAC. I don't want to go into much details of that because we have time. How will we time? We'll finish soon, huh? So this shows that BRAC is one of the largest NGOs, as Iftikhar mentioned earlier. It is the largest in the world, particularly in terms of the number of people reached and the number of staff that are working there. But it's not the largest in terms of budget, for example. BRAC spends about $1.3 billion every year. But the budget of NGOs like World Vision is about 4 times that of BRAC. So BRAC is not the largest in terms of the budget, but in some other so BRAC sort of success lies in the way that is how it defines poverty, and poverty alleviation is their main goal. And it believes that if you want to sort of end poverty, you have to address all the causes of poverty. People are poor not only because that they don't have any income or a lack of income. People are poor because their women are unempowered. People are poor because they don't have access to health care. People are poor because they don't have access to basic education. So in order to sort of reduce poverty, you have to address all the causes of poverty. And that's why BRAC has taken undertaken programs on all the things that are listed there. And finally, one thing I finished is that BRAC also believes in sustainability, not only on the sustainability of its work, but also on its own sustainability as well. So from day one, they have been thinking about how to sort of reduce dependence on donors, and they created several enterprises and so on. Now, as I said, that they spend more than $1 billion every year, and 80% of that budget actually comes from BRAC's own sources within the country, which means that the BRAC is dependent on foreign donors for 20% of its work. So, which shows that how BRAC has been able to really become sustainable in its own way. And of course, BRAC is one of the few NGOs which are evidence-based, in the sense that it has given, it gives a lot of attention to research and evidence generation. Finally, as I said, that there is no room for complacency, and here I show that we have done well, but if you compare with our neighbors, Sri Lanka, not to talk about Norway. In terms of maternal mortality, Bangladesh has a maternal mortality of 176, which itself is significantly lower than what it was 2 decades ago. But if you compare the current situation and compare with Sri Lanka, which is our almost next door neighbor, we have 176 and they have 30. So we have a long way to go. And our next target is to beat Sri Lanka. But there are many more challenges which are waiting for us. as we sort of try to achieve the Sustainable Development Goals, the SDGs, and also the Smart Bangladesh goal of 2041, when we want to become a developed country. So in order to reach that, there are many challenges that we have to face and address and solve them. Some of these are here. I don't want to go into details of these, but there are many of them out there, and we have to be really, unless we are unless we acknowledge this and try to address, we won't be able to reach what we want to reach. And these are some of the books that I have been talking about. The Lancet of 2013. The right-hand side is the Bangla version of the book that I present today. And the middle one is this book. Many of you have seen that. And the book is available from Amazon, although it may take a month to get it because the book is published in Bangladesh, and the Amazon takes about a month to get it from there and then distribute. It is also available in electronic copies as well. And these are the 20 different chapters that the book has for your information. So again, I wanted to thank you all for your very patient listening, and also before I conclude, I want to thank again our consulate here, Consulate General here, for arranging this and giving all the services, the facilities, and food and accommodation, and this premise for having this, and also to Dr. Iftikhar Mahmood for spearheading this, and the other two sort of organizations which have helped them, the FIU as well as the foundation. So I'm really grateful to all of you. Thank you.
Thank you so much, Professor Mushtaq Chaudhry. We have gotten good idea about what happened in past 50 plus years that since our liberation, and we have distinguished panelists. We have six. We have a lot of experts here actually, but so far we have six panelists. We'll hear from them, and also there will be a Q&A session. So if you want to ask questions, there will be a chance to ask questions. We will take just about 5 to 7 minutes break because it's a fair time. So we'll take 5 to 7 minutes break and we'll come back right after 5 to 7 minutes. Thank you. We have now. So I want to acknowledge the people in this room, the people that like us, who migrated from Bangladesh many years ago. After the liberation, there was so much, lacking of resources. We're hungry for higher education, the growth, opportunity to do something in life. Hundreds of thousands of Bangladeshis now is over 10 million Bangladeshis are living overseas now. It's at number 7 in the migration. The country-wise is number 7 now. The migrated. We have infused our energy, our resources. We love our country of land, bird. We send our money. In every Bangladeshi that I know have invested in their home village, either setting up a school or giving money for education for their cousins, children, building homes, building roads. If we can put together those information, I bet there'll be more than any NGOs, any donors that they did. And that is one thing that I believe that all the advances we made, that's one very, very big thing. I hope that someone, a researcher, even the young researchers here at the FIU, maybe you take up and see how actually the migrants, not only the people who came to US, you talk about Europe, talk about Middle East, talk about even Africa. People are every day sending money. I have sent money every month in my life, not for Hope Foundation only, from my family. You know, and I know that every one of you do that. So thank you for that. And we could not have done it if we were not what Dr. Chaudhary said, Professor Chaudhary said, that liberation, getting a country. We did not have a passport office in Bangladesh, you know, before 71. We had to get, yes, we had to travel thousands of miles to West Pakistan to get a passport. And imagine, you'll be issued a passport like that, as simple? No. Our people could not come to USA at that time. Our people could not come to Europe, right? So we got we have to be thankful and grateful to our leaders, especially our father of our nation, for giving us a country. So we got the passport. Now, you see, we are doing a program in our own embassy. Thank you for that.
And we was talking about hope. It is a practical journey of changing the life of millions of people, starting with the women and children. Dr. Silvani is here. I was just going to start talking about his idea and his comment, but I know I will not. But one of the pioneering work that Dr. Mushtaq Raja Chaudhary brought in front of us. I'm so proud, I cannot even imagine how it feels like. Because my journey to medical science in Bangladesh was very hectic. And still today I can tell you, American healthcare system is not good neither. So it was a journey that I always felt that if the environment does not improve, what I'm going to do? The drug policy was not there. 1978 I graduated, and I was first person who went to England. And David Morley gave me the assistantship in the tropical medicine. I refused it. I said, I'm going to go back to Bangladesh. There was a 2 building in atomic energy. I said, what is it for? We need human endeavor to lift up the people that is unable to provide their service. So anyway, it will take a long time to talk about me, forget about my own journey, but I can tell you all the things that I read in this book. I wanted to make sure that you know that who is actually behind. Not only our great writers and lifelong worker, but one of the things that we must not forget, Sir Fazlul Hasan Abed. We don't know that much about this man in USA, but what he has done for Bangladesh and other countries is absolutely unbelievable until you read it. Understand that. This whole thing started in 2006 by the Health Watch group. And it's incredible that at that time, really the pioneering work started. And this book is full of information. I'm so glad to read this one, and actually Bottomless Basket, it irritates me. We was told, and look, I'm not only talking about myself. Are we? No. In 1971, some of the people told me, Bangladesh cannot. Please don't believe that. We can, and we will, and we must. Thank you.
Great inspirational talk. Thank you, Dr. Professor Ahmed. Next, I will call on Professor B.M. Ghulam Kibriya. He is a professor of mathematics and statistics at FIU, and he also taught the University of British Columbia and University of Western Ontario, Canada, and also in Jahangirnagar University. Yeah, he's also bio is very long. I will make it short, saying that he's one of the world's top 2% scientists ranked, and he's not he doesn't boast about his career, but he's one of the finest researchers that Bangladeshi background in the USA. Please welcome Professor Kibriya.
Good evening. I hope all you are doing fine. I'll make it very short because listening to the people is not easy, very hard job. And I am not a good speech. I cannot give a good speech. Basically, I am not good at anything. Anyway. First of all, I want to thank Consul General, Mr. Iqbal Ahmed, Dr. Thekar. I want to thank Professor Reza Ahmed, who has a lot of accomplishment in his life. This is because of his dedication, hard work, passion about all about research and his achievement. I will make it short. Basically, as I say, I am not good at anything, but I do enjoy one thing. I am editor about now 30 different journals. I enjoy editing book, writing book. I have many publications. So I can talk a lot about it, but I don't take too much time here. I was talking chapter 15. He asked me to do. Before that, I feel proud myself as a Bangladeshi. I thank Bangladesh Sheikh Mujibur Rahman for his leadership and leading this country and making it independent. Chapter 15 about research capacity in health. Health science is a broad area. It consists different components: biomedical science, biochemistry, health science, health profession, many stuff. So this book mostly about the public health, and what they did in chapter 15, amazing work. I see all about the book. Mostly I spend time 15 because, as I say, I love doing research, productive research, not something genuine. I produce something. At the time of independence, we have only 6 public universities in Bangladesh. Now you cannot guess how many public universities we have. 14. Okay, now next question. How many private universities we have? Not no. Total. When I teach in the class, I try to let you know. 153 total. So it grows a lot. So sometimes quality, quantity both are important. So this chapter, especially those who are doing research in public health, I have a student, by the way, I'm a statistician, but I have some publication in the health area by statistics. And my, I think, third student doing PhD in biostatistics at FIU, he will be graduating in fall. And another student is doing biostatistics PhD. So I have minimum some kind of knowledge in this area. So when I read the whole chapter, something I never knew, for example, how many private school, public school we have. This chapter will be good, very informative and resourceful. Those who want to do some research in health science. So in summary, it differentiates between public and private university and order them based on the number of peer-reviewed journals. For example, ICTRB, Dhaka University, Rajshahi, Chittagong, Khulna. What surprised me, especially, the Dhaka Medical College is one of the oldest colleges in Bangladesh. And Mymensingh College is newer compared to Dhaka Medical College. And in the sense of publication, Mymensingh Medical College much ahead than Dhaka Medical College, which I can believe. So there is space, they have to do some, they have some space to work more. Second thing, as you see since Bangladesh independence, our GDP was much lower in 1971. Now we have the highest GDP among these India, Bangladesh, and Pakistan. So you improve a lot in the economy. But one thing is a little bit behind that Pakistan is the research. Our research productivity, journal-wise, is behind than Pakistan. So we have a space and we have to improve here, basically. Because they have called ACC, Higher Education Commission. Those are very strong, and they accept for the faculty and student only Scopus Journal. Is a journal where they have designated about 200 more journal publications, all are peer reviewed, and they don't allow anyone to get promotion to even the assistant professor without publication in international journal. Another thing is they have in their board to be promoted to associate or full professor. There will be one external from either America or Canada or European country. So they have some, they set their goal very strong, and that's why they are, if you if you have a role and be strong and you can follow the role, definitely that's the deep physical. So the university we have university grant commission who handle the system. I don't know whether they have. I believe they have a role. Maybe they're not executing properly. So we have to improve this space. We have. They are very potential Bangladeshi research teacher. I'm sure they can make it, but we have to do it. Finally, I like to thank Professor Ahmed Choudhury for his dedication, passion, motivation, hard work. And these 4 components make a success for any human on earth. And what he did, I salute you, sir. Thank you very much. Good evening.
Thank you, Professor Kibriya. It was a nice speech and talk about the research, and I think we'll have another speaker talk about research as well. Now I will call Professor Obhijit Borua. He is like my brother, and because his older brother is my very close friend in Bangladesh. And Borua teaches at FIU. He is a professor of accounting. He holds a PhD as well as an MBA from Dhaka Business Institute. He's the director of PhD program in FIU in accounting department. And I would request, we welcome Professor Borua to say a few words. Thank you.
Thank you, Therabai. Distinguished guests, today's keynote speaker, Professor Mustaq Reza Choudhury, and Honorable Consul General, Mr. Ahmed, and ladies and gentlemen. See, this is my honor to discuss such an important document that the 50 years of Bangladesh advances in healthcare, published by Bangladesh Health Watch of BRAC. If you think this book will take you in a journey that will show how Bangladesh has changed over 50 years, you will know tremendous advances made. You have heard from his delivery. In so many fronts, we surpassed in multiple parameters India and Pakistan. So these are not to feel good about. But at the same time, this book also talks openly challenges we have. Before we can say that healthcare reach to all people, I will highlight few things because of the constraint of time. But before that, let me congratulate the proud team of BRAC led by Professor Mustaq Reza Choudhury and 100 plus contributor, including Mahmood Bhai, Dr. Iftikhar Mahmood, to put together this book in this shape. It really shows how far we have come health-wise as independent Bangladesh and how far we still need to go. Now, let me give you a brief overview how I conceptualize such important documents, different aspects of healthcare covered in this book. In his concluding the article, Professor Reza Choudhury says, he gave a very good analogy on health outcomes. Lower hanging fruits, upper hanging fruits. That reminds me how to look at the total healthcare system. So I looked at 150 years old a theory. This whole healthcare system covered in this book, I can see in 2 pillars: healthcare infrastructure and healthcare superstructure. Healthcare infrastructure means physical building, hospital, technological equipment, all this. Ambulance, and healthcare superstructure is policy ecosystem, which will guide the whole healthcare delivery, governance, research and education, and more importantly, societal attitude and perception about health. This book covers almost everything. Out of those insightful chapters, I have been asked to select finance, which is a building block, most important building block any healthcare system. So, and this is a very well-researched chapter, by the way, healthcare finance. The authors, they have done a commendable job in unpacking the complex trajectory, historical trajectory of healthcare finance. Source of funds, how they analyze, allocation dynamics, and also policy shift across different regimes since independence. They also gave a reference from British colonial era, when healthcare sector was basically for British Army, that East India Company employees, and some handful of elites. Then came to Pakistan regime, discriminatory health policies that struck our whole healthcare system. We were 70 million people at that time. Pakistan was 60 million, West Pakistan. Whole national budgets, only 25% national budget was allocated for the poor East Pakistan, the then East Pakistan, now Bangladesh. Whereas, world's biggest jute mill, industry, paper mill, everything located in East Pakistan. Our healthcare and education was dependent on just agricultural land tax, which is the bare minimum. So this provide a very good base to determine how much we changed over the last 50 years. Let me tell you, what I found most surprising, we had to wait 25 years until 1997 to have a comprehensive health data. First, Bangladesh health accounting started in 1998 or 1997. At that time, during the time, there are a lot of policy shift happened and has significant change. And there was a project called HPSP, where I was fortunate to work when I was a faculty member at IBA, Dhaka University. So I worked there in that project as a consultant. HPSP, and these have changed. And you heard about the government expenditure, less than 1%. Okay, let me highlight one thing. Like in 1997, our current expenditure around 2.1% of GDP. In 2009, it came to 2.4%. Still, we are the bare minimum actually in the world. But there is a statistical flaw. If you read the between lines, since there is many articles I saw that criticism against Bangladesh that total health current expenditure is 2.5% since last decade, since 2009. That if you break it down, in fact, per capita spending in health has increased almost double. The reason is our GDP increase rate is more than 6%, but population increase rate is only 2%, around 2%. So our healthcare spending per capita has increased significantly. I haven't seen in many articles, but people criticize. So one of the paradox or mystery is there. GDP growth rate compared to population growth rate. And there are many stories I can talk about the finance. This is very well researched. But for the sake of time, I will not say. If anybody asks, I will say later, or call me anytime. I can explain whole day about the finance of about the financial system. What is more important right now? Right now, what is important? How, as we reflect on this extensive work, how to maximize the implication of this, how to maximize impact of this. Can reach inside of this book enhance superstructure of the country, because superstructure is more important than infrastructure. Superstructure ensures adequate or effective infrastructure we have, and it ensures most efficient use of infrastructure. So, but who makes the superstructure? Policymakers, legislators, regulators, and citizens collectively make the superstructure. And we need to change their mindset. Let me tell you one thing. 33 years ago, when famous economist, Professor Rahman Sobhan, handed over economic trust force to our then leader, at that time leader, our leader said, "Boi diye ki ar desh unnati hoy." Can the country be improved, developed by book? We need to teach them. I know leadership has changed over time. We need to change them. How? By breaking down this content into understandable, easy Bangla in Bangla newspapers. We see a lot of articles every day on many other forms, but healthcare articles not that many in Bangla. Then we can further clarify by focus group discussion, colloquium and all this. So I believe this book, I urge everybody in this room, I request you can obtain this book, sources is Amazon, and I request that. You don't need to be a doctor, you don't need to be a public finance specialist. Any background can be benefited by reading this book. So I will not go further. Let me thank our Consul General. Basically, we share the same alma mater. He also graduated from IBA Dhaka University. Actually, when I joined as a faculty, he was there. So thank you so much for your generous hosting the program. And also, Dr. Mahmood, visionary leader, who made tremendous difference in the life of vulnerable and underserved group in Bangladesh by bringing quality, crucial health care to those people. And of course, Professor Reza Chaudhuri. And above all, everybody, please enjoy the rest of the night. Thank you.
Thank you, Professor Burwa, for passionate speech and informative. We need to explore more on the financing side and superstructure, definitely. And I'm sure Professor Raza is taking note and will go back and talk to his team at Bangladesh Health Watch and Bangladesh Education Watch about those things. And now I call on Dr. Abu Sanchoy, very talented professor, associate professor of economics at FIU, and he is a graduate, he is a PhD from University of South Wales. He recently joined a few years ago to FIU, and he does tremendous volume of work in Bangladesh. And I heard him yesterday talking about his work. It's fascinating. We'd like to work together in the future. And welcome, Abu Sanchoy. Thank you.
Thank you very much for giving me the opportunity to talk in this podium. It gives me immense pleasure and honor to discuss this book. I know Mustak Bhai from various different sources, and I'm very humbled to discuss this book. Because it's only 5 minutes, so I'll try to talk about some of the statistics that we have discussed so far, and giving a sense of what these statistics mean. Because this is important, like how to translate the information into a meaningful comparison. So one statistic that we have all talked about today is life expectancy. So those of us who do research in development economics, so we have an index, it's called Human Development Index. So United Nations created this Human Development Index, where we belong. In that index, there is one variable that captures the health quality of a country. So if I ask you that, tell me one index that will capture the quality of healthcare in a country, what that index would be. And that's the life expectancy. So in 1970, before the Liberation War, the life expectancy we had was is about 47 years. So anybody who was born at that time has a life expectancy of 47 years. Compared to that, Pakistan, which is West Pakistan, they had 53. So there's a 6 years gap. So history has repeated itself now, but in a reverse order. So now our health expectancy is 6 years ahead of Pakistan. And this is a remarkable progress that we have achieved, despite all the problems. The second indicator that has used in this book, and which is very, very fascinating, which is the infant mortality, under 5 mortality rate. So under 5 mortality rate is typically used with 1,000 live births. So in 1,000 live birth, number of child who will not be able to survive. In 1970, we had 260. Out of 1,000 births, 260 child will not be able to survive before the age of 5. Now that number is 32. 32, from 260 to 32. And this is a remarkable achievement. Now, so if we take a step back and think about how this magic happened, what we have done. So there are three actors that we have to contribute. So one actor is definitely the supporting policy by government and government investment. There is a second important actor, which is the civil society, the NGOs, BRAC, ASHA, Proshika. They have done a remarkable work in terms of going to door. We have talked about family planning, we have talked about community health workers, right? This community health worker model has been now replicated in multiple different countries. Even in Pakistan, they have lady health workers, which has been replicated by the community health worker model of BRAC. And these community health workers go door to door. Door to door, literally each household has been touched and been advocated for nutrition, for immunization, for healthcare. This is massive. Then the other actor, and which, because I was talking about chapter 12, and chapter 12 is written by an economist and who is also my co-author, and which we need to contribute to some extent, is the economic impact that we have achieved. So we have reduced the poverty. And I have discussed this with many students that many people don't understand how to calculate poverty. I give you a very straightforward indicator how to calculate poverty, which is the poverty line, which is $1.90. So if somebody's income per day is less than $1.90, is known as poor. Okay, what is $1.90? Imagine a cup of coffee. What is the cost of a coffee? Is the minimum, I think, in USA, if you go to a department grocery store, you have to pay $2, right? So imagine somebody's entire days of work does not worth $1.90, is known as poor. In 1970, the number of people who are below the poverty line was 70%. 70%. So out of 100 people, 70 people is below the international poverty line. Now we have 23. In last 30 years, we have transitioned about 50 million people out of poverty. So these three actors, government, NGOs, but also our economic development. And economic development happens through 5 facts. Number one is our transition from agricultural country to an industrial country, a manufacturing sector, which is ready-made garments. The second one is migration. We have enormous number of people migrating outside of the country. They are sending remittance back to home, and that is a bare bone for many poor families. They receive the remittance, they can buy healthcare. Number 3, helping women to become more educated. So we have education program, we have stipend program that encouraged women. And this is one of the first conditional cash transfer program targeted to women. That if girls come to school, we give them stipend and education is free. And we have transitioned into the reversal. In 1970, we had 100 boys but 45 girls going to school. So if there is 100 boys going to school, only 45 girls will go to school. Now it is opposite. Now we have 106 girls versus 100 boys. So this conditional cash transfer actually made girls to become more educated. And that has been translated into greater women engagement into economy. So we have 36% female labor force participation. On top of that, we have microcredit, the microcredit revolution that Mustak also mentioned. Microcredit gives financial access to women. So if you ask me to sum up what is the miracle of Bangladesh health sector, and if I take a step back, the community health workers, female. The microcredit is given to female. Education, female. Garments worker, female. So to me, the development miracle of Bangladesh is women empowerment and women-centric, and all hats off to the mothers who have made the contribution. So that's the development miracle. There is no magic happen. The entire core concept of development, the miracle, is women empowerment. Our mothers, our moms, my mom, my wife, my daughter. these are the development miracle practitioners. They made this thing happen. Now, just to, if I get 30 seconds, I think we should not wait here. There are a lot of challenges ahead of us. And I think a few challenges I would like to convey to Mushtaq bhai. One is the rising inequality. So we are seeing that with the rising income, it is creating inequality. And why inequality is problematic? Because it's still the healthcare in Bangladesh. We have a lot of out-of-pocket expenses. So people have to pay. So if a large chunk of your money goes for healthcare, then it will create an inequality. Only rich can access healthcare, poor will not be. So rising inequality is very alarming, and we need to do something about reducing the inequality. Second is government expenditure, government support for health. We really need to do something about it. Number three, and this is also important for countries like USA, non-communicable diseases like diabetes or disability is rising. And we need to do something about how to tackle this population who will be diabetic or disabled. Number four is very important, and as a researcher, I always felt the need, which is our data is not available. So when I want to train young scholars, we want to give them data. So more surveillance, more unlocking data, so that more and more researchers can work and get engaged into the research and could contribute. So with that, I would like to conclude my session, and thank you very much for giving me the opportunity.
Thank you. Great talk. And we all concur with Dr. Sanchoy about our mothers, our sisters, our daughters, their contribution to our growth. Honestly, that's the key. You know, in Bangladesh, as I started, when I said in the past 34 years, we have been led by two charismatic and visionary ladies, and we are still in that situation. And I think that's the key. This made a big difference. I would like to invite. We have two speakers. There is a reason why they came, because in past a few decades that I have been in South Florida, including our other colleagues and doctors, these two people that we have found very passionate about Bangladesh. Whatever there is a situation that we talk in an event in Bangladesh, they're always here, and they have, they're very busy people. It's Sunday, and I want to thank you for coming. But first, I will call Dr. Marty Eccles. She is the Vice President of Research and Academic Affairs at Larkin University. She served as a Dean of College of Biomedical Sciences of Larkin University from 2019 until her retirement in 2023. She also served in Nova Southeastern University as well as Arkansas College of Health Education. Through her integration of her extensive experience and knowledge, she has been recognized nationally for her research and publication. I would welcome and request Dr. Eccles to say a few words.
Thank you everyone for coming. I am so honored to have the opportunity to speak. I can't tell you enough how important it is for those of you in the audience to purchase and read this book, okay? It is so uplifting. My education on international medical education began, we're not saying what year, but there were 10 of us selected, and I was the representative from the United States. And so I began that journey of studying medicine across the world at that time. And I have always had a passion for it. I really focused a lot on medical education per se, and medical schools, in particular medical colleges, residency training. And I was amazed as I read the book. Two very unique things that I want to mention, and I think, first of all, I can't reiterate enough, there is so much research going on in Bangladesh. There is so much being done, and it's captured in the book, but we need to do a better job of getting the word out. We really need to say, okay, what can we do to bring highlight to the research that's being done. With 49 public universities and 107 private universities, that's a lot of research, folks, that we really need to be banging on that door. That made me take a closer look at what is happening in terms of healthcare in the country. And for me, healthcare looks at what does your workforce look like. Everything is about your workforce. You're trying to tackle by 2041, you want universal healthcare in Bangladesh. That is a really big issue. We haven't figured out how to do it yet in the United States, so we'll be looking for leadership and ideas for sure. But I looked at that and I said, okay, what's happening with medical education? We have 26 government medical schools. You have 66 private medical schools. You have 1 armed forces and 5 Army medical schools. That's over 30, almost, 70? More than 70 medical schools in that country. You have 8 government dental schools and 20 private dental schools. We are building, they have the infrastructure to develop a healthcare workforce that can tackle the issue of universal healthcare. My challenge to the country, as you look through the next years to come, what are you going to do to capture your intellect to stay in the country of Bangladesh and not migrate out to other places? Because you're getting the education you need to deliver on your goal. But you must figure out a way to retain your talent in your country in order to be successful. Lots of great things happening. I am so impressed. I cannot believe what you have accomplished in really such a very short period of time. But I think that you are up for the challenge. I'm proud of your accomplishments and your leadership that got you there. And I hope I'm not still here in 50 years to see what the next 50 years will bring. But I'm hoping that the leaders and the young people in the audience will get us where you need to go. No complacency. Thank you all.
Thank you, Dr. Eccles. No complacency. That's the message we'll take tonight. That I want to introduce Dr. Silvani. He has a long bio, but I would say that he's a legend in not only in South Florida, but in the US. He recently retired from his job as a Dean of Medicine at Nova Southeastern College of Osteopathic Medicine. He was also, for many years, was the president of all the deans of South Florida. He's nationally recognized. He has a DO, he has Masters, MPhil, and many other. But whenever there are issues that we need wisdom from, we always go to him. We ask him, he gives in simple answer, but very deep. So we're here, that's why we have him as the last speaker. Dr. Silvani, it's a great, great honor to have you in our program. Please say a few words for us, our audience.
I'm Italian and I need my hands. It's a privilege to be able to follow the previous speakers and to be here before you. Honorable Council General, Dr. Chowdhury, and everyone else, I don't want to go through all the names. You can see the energy, the inspiration, the drive. This is why so many of us who didn't know that much about Bangladesh became involved, watched you all become empowered, watched the advances that were occurring. But the challenges are real, and the progress is fantastic. But as you get down to the closing end, as you get closer, it gets harder. Remember, it takes 90% of your energy to finish the last 10% of the project. And that is the reality, that this is going to get not easier, but more challenging. I want to touch on two things, and I'll try and be short, besides my height. After some of these tall people are way up there. First of all, life expectancy. You need to understand life expectancy to know what's really being said. We live just as long as everyone lived 100 years ago. People forget that. The difference is not that many could make it to get there. That's why the life expectancy. So by attacking maternal mortality, by vaccinating children, they live longer. I don't know if you know or not, but the life expectancy in the United States declined during COVID because so many young people died that our life expectancy went down when you did the average. After COVID, we went back up. So the fact of attacking maternal mortality, besides its importance and the fairness of it, and child vaccination and early child infection will affect your life expectancy of a country. And that's what's being done. But it's going to get harder. As people get more successful, they get more lazy. Look at us, the US. You're building your public health system. We're tearing ours down. We're separating. We're becoming more segmented. It's frightening. Unlike Dr. Eccles, I want to be here the next 50 years, but I don't know if I'll get the choice. But I want to know that I'm here, too. I mean, that's the other part of it. But the reality is that we've got to look ahead for all the things that we have to do for the people behind us. And that's why all of these directions that are being done. The economic is the hardest issue. I agree. To find the money is always the most difficult. To get people to give up something, to do something for the common good, is always hard. That's why the tax breaks went to the ultra-rich in the US. And the middle class thought they got a break for a couple of years and then it went away. Trickster. We have to continue on this path of this high energy, this high belief. What got me sucked into it, thanks to Dr. and something. They got me into it, but you can't say no to them because they're so passionate and they're so real. An exciting thing happened on Thursday. I don't know how many of you know or not, but Sima Wasser, I think her name is, was it? Just got appointed the regional director for Southeast Asia. First Bangladesh person, second woman ever in Southeast Asia region. It is the largest region of WHO by population in the entire world. And she was picked for the next 5 years. You don't think they didn't look at Bangladesh when they picked her? Certainly they did. When they see the miracles, and they are, people don't always define miracles the same. To me, I'm a realist. That's a miracle, what's happened. And when people see that, they begin to believe. And when they believe, they'll help you more. The book brings that further forward and helps because, again, as was said before, the information has to get out there so the world knows. And that's what's happening. I'm an Italian. I'm not going to keep you from your food because that's our national. Everything is food. So I'm going to close with that and say thank you all. And I think it's Umbat. Okay. Thank you.
Thank you, Dr. Zoe. I told you, he's different from everyone else, and so you saw the proof, right? Thank you all for your time, your wisdom, being here. I know there are many other people who want to, have the expertise to participate and give us, information, ideas, but so that's all the time we have, but we would welcome some questions. If you have questions, please, raise your hands. Let me see just raise your hands. So 1, 2, 3. Anybody else? Then I will call, 1, 4. Okay, 4 is good. So, okay, first, Mirza. Mirza Bhai, please ask your question. We don't have mic. Maybe you can.
No, that's fine. That's fine.
Oh, there's a mic? Okay.
Hello.
Just
Yeah.
say your name and
Yeah,
who is the question to.
Yeah, I'm Mirza Awal. At first, I would like to convey my thanks to the team, especially Professor Reza Chaudhary, then Dr. Mahmood, and of course, our Honorable Consul General. You have just discussed today's topic, which is the 50 years of advancement in healthcare sector in Bangladesh. And definitely, we had a lot of advancement. But two questions is coming to my mind. Due to a lot of advancement, still our Bangladeshi people, lot of people are going to our neighboring countries for treatment. And people say that they have lack of faith on the treatment or on healthcare system of Bangladesh or of own country. So is there any advancement really happened to address this situation? This is number one. Number two, what we could do for our senior citizens in terms of their treatment. Is there any special advancement took place? Because normally, once I am young, I am likely to face lot or less amount of healthcare issues. But once I grow old, I will be encountering a lot of issues. Thank you.
Thank you for these important questions, of course. First of all, why some Bangladeshis go to other countries, of course. There's a sort of major problem in the sense that it also makes that a lot of our resources, foreign currency and so on, go on. But if you look at the reason why we have done well so far is what we have called the addressing some of the lower hanging fruits, which are mostly the things like the public health actions, ORT, immunization, TB, and so on. What sort of means that the next challenges that we have will be how do we really address the higher hanging fruits, which includes things like the strengthening the health system. And that remains to be the major issue that we have to really address in the next several years. As you know that like many other countries, we are also sort of moving to a situation where the non-communicable diseases such as cancer, hypertension, diabetes, etc., becoming more and more important because we have been able to really address the communicable diseases well. The death rate, 65% of the deaths that happen now are in the sort of non-communicable diseases. So to take care of these, you need a very strong health system, which can sort of which can take care of every citizen in every citizen's health in a very sustainable way. But unfortunately, we haven't been able to really do that. And in order to sort of stop people from going abroad, is that you have to have your own system so that they don't need to go. And for that, we really need to go for what some people call the universal health coverage, which is ensuring everybody with good health care at an affordable cost. But we haven't been able to really reach that level to address this. So a long answer to your question, of course, is that that's one of the challenges. That unless we really strengthen our health system, people will be going outside. But people go not only for health care, but they also sort of combine that with other sort of objectives. Tourism, for example. People go to Bangkok. I mean, one of the reasons is that they will have their checkup at Babrulgarh Hospital, but also they have other things to do. So that also is there, of course. But we also seeing now that there is also a reverse flow starting now. Only a few days ago there was a report in the Bangladeshi sort of newspapers